Today we are reporting an additional 70 cases of COVID-19, bringing the total number of cases in Alberta to 5,836. Of these, 2,942 people have now recovered. Since my last update, we have also confirmed 9 additional deaths in the province. This brings the total number of lives lost to 104. Reaching more than 100 deaths is a somber milestone. 4 of the 9 deaths reported today occurred within the last 24 hours. The others occurred in previous days or weeks. Sometimes it takes time to confirm a death was related to COVID-19. As the number of deaths in our province increases, so does the number of grieving families and loved ones. To everyone who is feeling the pain of losing someone to this virus, I extend my sincere condolences, as well as to anyone grieving the loss of a loved one from any cause. As of today, there are now 621 COVID-19 cases in outbreaks in continuing care facilities across the province. At High River's Cargill meatpacking plant, there have now been 936 cases, 810 of whom have now recovered. There have been 469 confirmed cases in people who work at the JBS plant in Brooks. Including these, there have been 998 total confirmed cases in the city of Brooks, underlining that this is not an outbreak limited to a work site, but a complex outbreak that needs interventions across all settings. I want to emphasize what that means for how we need to support those who are impacted. I have heard stories of discrimination against newcomer families, with assumptions being made that any workers at Cargill and JBS and their families are a risk to others. People who are cases or close contacts will be supported by public health to self-isolate, but this is not required of all employees or families. When people are stigmatized or targeted, it blocks our collective ability to control the spread, as people may fear getting tested or talking to public health. We should be supporting people who are in this situation, not stigmatizing them. As I have said before, when we focus on a single site without taking a comprehensive approach to stopping spread in all settings, we will not be successful in outbreak control. I want to also tell you today about an outbreak at the Purolator Distribution Centre in Calgary with 30 cases in employees. The company is working closely with Alberta Health Services Public Health, putting in place outbreak precautions, and supporting AHS to offer testing to all employees. I also want to update you on 2 sites where prompt reporting and early intervention led to prevention of spread. Both at the Safina and Mountain View chicken processing facilities, a prompt report to public health of just 1 or 2 confirmed cases meant that testing of all workers, isolation of cases and contacts, and outbreak precaution implementation all took place within days of the notification. So far, only 5 cases have been identified at Mountain View and 2 at Safina, and some of those cases may have been acquired outside the workplace. As of today, 164,722 tests have been performed in the province, including 3,775 in the past 24 hours. Our aggressive testing approach is helping us identify cases quickly, and coupled with improved contact tracing ability, thanks to the AB Trace Together app, we will enhance our success in preventing further spread of the virus from confirmed cases. Today, we are further reinforcing our ability to detect new cases by expanding our testing eligibility and the list of COVID symptoms that qualify a person for testing. Individuals who have any of the following symptoms are eligible for testing: fever, chills, a new cough or worsening of a chronic cough, new or worsening shortness of breath or difficulty breathing, sore throat or painful swallowing, stuffy or runny nose, headaches, muscle or joint aches, feeling unwell in general or new fatigue or severe exhaustion, gastrointestinal symptoms including nausea, vomiting, diarrhea, or unexplained loss of appetite, loss of sense of smell or taste, or conjunctivitis, commonly known as pink eye. This expanded list is based on new and emerging information on the virus. The AHS self-assessment tool online has been updated to include all of these symptoms. One of the other things we have seen in emerging evidence is the possibility of cases that remain asymptomatic throughout the course of their infection. While most people who get infected will eventually feel sick, there are some who do not. In order to improve our chances of finding these cases who may not experience symptoms, today we are also expanding the availability of testing to all close contacts of confirmed cases, whether they are feeling symptoms or not. Finally, one additional testing expansion we are putting in place is a protocol to test all those who are newly admitted to any continuing care facility in the province, as well as testing those who live in these facilities when they are admitted to hospital or when they are discharged from hospital back to a facility. We will continue to use all the tools available to us as we build our plan to reopen businesses and public places over the coming weeks and months. We need to gather as much accurate information on how the virus is spreading as we can. This will help us to make informed decisions that weigh and balance the intertwined goals of protecting Albertans from spread of COVID-19 while cautiously enhancing social and economic activity which also support Albertans' health. I am encouraged to see the AB Trace Together app now has more than 103,000 users. I hope more Albertans will choose to download the app to increase our contact tracing ability. I know we are all looking forward to moving into the relaunch stages. We will get there sooner if we continue to follow public health orders, stay home and take the AHS online assessment if you're feeling unwell, and getting tested if we're instructed to do so. This will help provide a clear picture of how the virus is affecting our communities. With respect to the number of deaths reported today, one thing to remember is that these are deaths that occurred over the past week to 10 days. And so while each death is a tragedy and everything we're doing is to strive to prevent tragic outcomes like these, it is important to not take the reporting of all of them on a single day to indicate a particular trend in time, because again, only 4 of these did occur within the last 24 hours. So with respect to a trend, we really need to look at when those occurred. With respect to the number of new cases, we see right now a decline. So we were seeing several hundred new cases a day. I think that one of the factors that does affect the number of new cases a day is our testing regime with respect to how aggressively we're testing in different areas. And so as we've been testing in some particular outbreak settings, we have seen numbers rise when those test results come back. And now we're seeing more of a kind of population average with respect to the testing that has come back within the last 24 hours. So I think that it's obviously a good thing when we have fewer cases, but part of the reason that we're expanding our testing eligibility today is to make sure that we are casting the net as wide as possible so that we have as good an idea as possible of where we may be having cases. So I think that Albertans should be encouraged by the lower number of new cases, but also vigilant, because we can see with some of the outbreaks that we're experiencing that depending on the circumstances of how people interact with each other, that there can be spread where a small number of cases can quickly become a large number. So I think that's also important to keep in mind.